And welcome everyone. We're a minute late, but we're allowing people in to our second roundtable on shelter, homelessness, and housing. This roundtable will be focused on data and homelessness. And we have great people presenting with us today. And Sam, you can take it from here.
Yes, so I'll just introduce myself as well. I'm Samuel Maddox. I'm an architect and the co-chair of this panel. So we're picking up from where we left off last time, which was in October, was it, John? I think that's right, when we had our last panel where we were speaking with people who are acting very locally and very intimately to work with the issues related to homelessness. And just as John said, today we'll be looking at data. But before we get into the question of data, its usefulness and its limitations, I would like to walk everyone through a little bit about our panel more generally, our mission and goal of this roundtable. So the mission and goal, I'll sort of read from this, but add a little bit as I go. The mission of this roundtable is to raise awareness to the issues and obstacles encountered in the process of providing shelter to people experiencing displacement and homelessness. Our goal is to create an engaging space for the aggregation of data, applied research, and personal narratives, so that we as designers may be more prepared to act with compassion and understanding, whether that be directly through our work or through our advocacy. In doing so, we hope to uncover and bring into focus the state, extent, and causes of homelessness, as well as the lack of shelter in the greater Boston area, with the eventual goal of exploring solutions to the roots of the problem and empowering others to do the same. So tonight we're going to be hearing from two experts in the areas of data and homelessness. They are Riordan Frost, who he is a research analyst at the Joint Center for Housing Studies at Harvard University. And we're also going to be hearing from Tom Byrne, and he's an associate professor in the School of Social Work at Boston University. So first, Riordan will be up and he's going to be talking about data sources that we have and where they come from. After Riordan speaks, we'll have some time for some clarifying questions to answer any sort of gaps that may be left from his presentation, just to ensure that we're all on the same page. And then we'll transition after that into Tom's presentation, where he'll talk about using data sources that we have to better understand the drivers of homelessness. So bringing that and applying that even further to the question at hand here. We'll also take some time after that to make sure there's not any sort of issues or sort of clarifications that need to be made per Tom's presentation. And then afterward, we'll have a conversation, bringing all of the content that we've heard tonight into conversation with one another and in conversation with your own curiosities, questions, and concerns about this topic. So with that said, I would love to hand the floor on over to Riordan. Welcome.
All right, thank you, Sam. Let me share my screen here. And let me know if you can see that.
We can, yep.
Okay, excellent. Thank you very much. I'm very happy to be here, and I'm very happy to be talking about this really important issue. So my name is Riordan Frost. I'm a research analyst at the Joint Center for Housing Studies. For those of you who don't know, we measure and research and analyze all things kind of housing policy, and everything kind of related to that. And homelessness is a really important part of that as well. And so today I will be talking about the kind of national data sources that I use to measure homelessness. And there's really only a few kind of key annual updated data sets for this. And so I'll be kind of going into them, looking at how they're made, what their limitations are, and then some of the things that it can show us. But Professor Byrne will be talking more about what we can kind of do with the data. So first up, there we go. First up, the big question that these data sources are trying to measure: how many people are experiencing homelessness in the United States? And so the different data sources at different times and different kind of how recent the data is. And so the most common one that you'll see used almost everywhere by researchers is the HUD point in time estimates. The most recent kind of complete data for this is from January of 2020. They did actually release another report just this month that I'll talk about in a bit. But in January 2020, both sheltered and unsheltered homelessness, the estimate was about 580,000 people were experiencing homelessness. And then according also to HUD, so that was a HUD part one of their report. And then also according to HUD, but not looking at a point in time, looking at over the course of a given year, is part two of their report, which just looks at sheltered homelessness, and it uses administrative data to get into that. And it finds that 1.4 million people experienced sheltered homelessness at some point during 2018. And then another annual data set that is national and a good data source as well is on public school students, which the Department of Education collects and finds that 1.3 million public school students experienced homelessness at some point in time in between 2019 and 2020, which is a really stark and honestly a horrifying number, as are the others. But I think this really kind of brings it into focus how important this issue is to address. So to get into each data source, the first one, the point in time estimates, are from the annual homeless assessment report known as AHAR. I'll call it AHAR for the rest of the talk. Part one, the point in time estimates. So as I mentioned, it's a HUD report, Department of Housing and Urban Development. It's based on a nationwide count on one night in late January of every year. And each continuum of care kind of canvasses their area. So to define that jargon, a continuum of care is essentially the planning body that coordinates homelessness services in an area. And they really vary quite widely in terms of shape and size. So there's a continuum of care for Boston. There's a continuum of care for Cambridge. There's a continuum of care for the entirety of Cape Cod, essentially. There's a map at the end of this of the continuums of care of Massachusetts that I can show if anyone's interested, or also these slides will be shared, I believe. So each continuum of care kind of canvasses their community, and often, primarily, they measure sheltered homelessness using administrative data that the shelters collect. And then, so the counts often focus on the kind of unsheltered homelessness, and it can either be a census, so they try to measure every single person, or it can be a sampling, so they try to just measure a representative sample, and that sampling method has to be approved by HUD. And then staff and volunteers go out and conduct the count. People go to places where they think that people are sleeping, people are sheltering. They sometimes go to emergency rooms, because if a person is not staying in a hospital overnight, then they are still considered literally homeless if they don't have a place to go. And then to obtain demographic information, whether it's age or race or even veteran status, interviews are conducted with people. Where interviews are not possible, sometimes observations are made, sometimes assumptions are made. And I have a link here to a Chicago Tribune op-ed that kind of found this process objectionable, a little dehumanizing to be kind of making those assumptions and to just be, kind of counting people and stuff like that. And that was one call among many to kind of reform this, but this is some of the best data that we have. So there's kind of a balance here between the limitations and the strengths. And then for the most recent complete data for the point in time, that's from January 2020, so that's pre-pandemic data still. And that report was published in March of last year. But then the most recent data is from January 2021, which is pandemic data. But unfortunately, because that was before the vaccine rollout, still relatively early on in the pandemic, a lot of continuums of care were not able to conduct their count. They didn't want to put people more at risk, risk spreading COVID-19, et cetera. And so there were some continuums of care that did the count, but there weren't enough to have a representative sample. And so HUD did not include any estimates of unsheltered homelessness. So instead, what that report has is just this estimate that you see here that just says 326,000 people were experiencing sheltered homelessness in January of last year. And that's about an 8% decline from a year prior, but that doesn't really mean that we reduced homelessness during the pandemic. The report itself says that that's probably more of a reflection of decreased shelter capacity. So then going to part 2 of the AHAR report on sheltered homelessness. It's a separate report. It's released on a different schedule, also from HUD, and it estimates the number of people who experience sheltered homelessness at any point over a given year. It uses data collected in these homelessness management information systems in every continuum of care, and it defines sheltered homelessness as specifically being just emergency shelters, safe havens, or transitional housing. And the most recent data for that is 2018, which was published in September 2020. So you can see that that's a slightly longer lag than the point in time estimates, and uses administrative data instead of account. And that one is the one that found 1.4 million people experiencing sheltered homelessness over the course of a year, which, as you can see, is much more than 326,000 just at one point in time, and even than 580,000 in January of 2020. So then moving to the student homelessness data, this is from the US Department of Education. It's collected by the National Center for Homeless Education at UNC Greensboro, but specifically sponsored and published by the Department of Education. And it estimates the number of students enrolled in public school who experience homelessness during a school year. So this is collected by school districts because students who are experiencing homelessness have a legal right to attend the school either in the place where they are experiencing homelessness or in the place where they were before they were experiencing homelessness. And they have a right to the transportation as well to whichever school is in their best interest for that. And so then that data is collected and reported to the Department of Education. And in 2019 to 2020, that's the most recent data available that school year. It was estimated that 1.3 million public school students were experiencing homelessness, and about 78% of those were actually unhoused students. 78% of those were doubled up. And that is an interesting thing because AHAR, part 1 and part 2, all of the 1.4, 326, 580, none of those numbers actually measure anybody who's doubled up. And what I mean by doubled up is you're living with family or you're living with friends. But specifically because of like housing insecurity. And so this is measured in the student homelessness data. And what you finding that a majority of the students experiencing homelessness were doubled up really makes it clear that if we could measure doubled up with the whole adult population, these numbers actually might be a lot higher. But that's not measured in AHAR, but it is measured in the student homelessness data. So what are the limitations of this data? As I've kind of already mentioned, the point in time estimates are almost definitely an undercount of homelessness. January timing likely affects the accuracy. If you're in a colder state, it might be harder to find people who are sheltering from the cold in different places. There's some subjectivity inherent in the interview and observation process. And it doesn't count people doubled up with family and friends. As I mentioned, that doesn't fall into the category of literally homeless for HUD's definition. That does fit into the definition of student homelessness, but it doesn't fit into that literal homelessness definition from HUD. And there's a report from the, I might remember the name wrong, but the National Law Center on Homelessness and Poverty, I think it is, called Don't Count on It from 2017, that kind of gets more into the issues with point in time estimates. So, this is only like basically 3 data sources, a 2-part data source and a 1-part data source. So there's definitely a scarcity of data sources here. So that's a big limitation of the data. The National Center for Homeless Education has a good list of available sources, but these are basically the only ones that have annual updates on a national level. And then there's also the timeliness issue. So data release ranges from 1 to 4 years after the data period. That AHAR Part 2 being from 2018, it's 4 years ago now. And there's a lack of data reflecting the effects of the pandemic. So AHAR 2021 that was released just this month reflects some of the sheltered effects in terms of decreased shelter capacity, but not really any of the unsheltered effects of homelessness on homelessness. And the data scarcity is not just a national problem. The Menino Survey of Mayors was recently released and had a special focus on homelessness. And it specifically looked at, what frequency mayors have access of city level data. And it found that almost 40% of mayors only have annual data available to them on the city level. Just over a third have monthly data, and only 3% have daily data. And then 10% have no city level data at all. And 8% of those have county level data, but it's just, this really, I think, underlines that, I'm primarily working with national data, but if you look at city level data, a lot of cities are working with the same data that I'm working with on the national level, but drilled down to their area. But that's just annual data released with like a time lag. So, and the survey also found that most mayors thought that lack of data really hindered their ability to address homelessness. So this is definitely an issue in terms of data availability and quality. But on the brighter side, what are the benefits of this data? And in one word, as far as I'm concerned as a data nerd, it's that we have data. It allows analysis of the current state of homelessness. It allows analysis of kind of demographic differences, geographic concentrations of homelessness. You can compare to previous years. The AHAR data goes back to 2007, and it enables making connections to correlated things like housing affordability. What's shown here on the left is an interactive map that I made that is at the Joint Center blog here, published in 2020, where it just shows the change in homelessness from 2018 to 2019. And if you go to that site, you can kind of hover over states and look at more data or toggle between sheltered and unsheltered homelessness. Another example of using the point in time data is that you can see, you can break it down by individuals versus people and families with children. You see that people and families with children are much more likely to be sheltered, and there's fewer people and families with children experiencing homelessness rather than individuals. And then the recent increase in homelessness, this was in the Joint Center's rental report that we just released last month, has actually really been driven by individuals experiencing unsheltered homelessness. And then another example is kind of the demographic differences. You can really see that people of color disproportionately experience homelessness. AHAR data shows this as well, but this is actually the student data that I wanted to highlight here. And the purple bars show you the share of unhoused students for each racial category, and then the share of all students. So essentially, if the purple bar is larger than the orange bar, that group is disproportionately experiencing homelessness. So for Hispanic students make up almost 40% of students experiencing homelessness, but less than 30% of all students, all public school enrolled students. So that's just some examples of kind of what you can do with this data, and really shows you how you can drill in and see where the problems are and what needs attention. And then the next slide is the connection to housing affordability that I mentioned. You can really look at this data to make these connections to these correlated issues. And this is another interactive chart that I made of states with their cost burdens compared to their homelessness ratios. And so again, at the Joint Center blog and in the interactive, you can kind of hover over the different dots to see what those states are and what their cost burden rates are and everything. And my colleague, Professor Byrne, will be talking more about the connection between homelessness and housing affordability. So that is all. I will.
Thank you so much, Riordan. This is a great time if there's any clarifying questions for Riordan about any of this content. I'd love to go ahead and see if we can help fill in, or not we, but if he can help fill in any of the gaps there before we move on to Tom's presentation. All right, and if not, then Tom, feel free to go ahead and grab the screen share from there.
All right. Can you guys see the slides?
Yes, I can.
Okay, great. All right, well, thank you guys very much for having me here today. The name of my talk is Homelessness is about housing. And my plan here is really to just give you a couple of snapshots from some research that I've been involved in for more than a decade that relies on the data that Reardon was just talking about, these point in time counts of homelessness, which are incredibly useful because they allow us to look at factors that might help us understand why rates of homelessness vary across communities and within communities over time. So trying to understand sort of the structural or city level factors that might explain why some places have relatively higher rates of homelessness, or why homelessness might increase more quickly in one community relative to another. And my goal is really simple. It's just to make 2 points to you. First, again, Reardon teed me up nicely because he provided a great synopsis of the sources of data that we have on the extent of homelessness in the United States. And I've been involved in research that uses those data to try and understand, as I said, factors that might explain why homelessness is higher in some places than in others, or why it changes more quickly or less quickly in some over time in some communities as compared to others. And really the clearest finding from that research is that homelessness is primarily a housing problem, and housing market factors are the biggest driver of homelessness in the aggregate. And I'll explain that with some snapshots from some studies that I've done. And second, the key point I want to make here is that we know that kind of policy interventions, so certain interventions at scale, are effective for reducing homelessness. And I think these 2 points are important for a couple of reasons. First, I think there's a narrative that's out there in the world that's fairly prevalent that sort of frames homelessness as really being a problem that's about substance use disorders or about mental illness. And I think what I want to try and emphasize today is that the research that we've done kind of demonstrates that that's not entirely the case, that really housing market factors are the key drivers of homelessness in the aggregate. And second, I think it's important to make it clear that homelessness is not an intractable problem. We have solutions that are effective for reducing homelessness, and if we apply them at scale, we can make real progress in reducing the scope of homelessness. So those are kind of the 2 points that I want to make today. All right, so to that first point, I've done quite a bit of research that's relied on the data sources and combined it with other community level data, relied on the data sources that Reardon talked about, and has used other community level data to try and look at the extent to which community level factors are drivers of homelessness. And a key question that comes up in this body of research is whether there's a connection between housing affordability and homelessness. And I'm going to cut right to the chase here and just say, yes, there is evidence that supports the idea that homelessness is ultimately a problem that's rooted in the lack of affordable housing. And I'm going to share with you just one snapshot from a study that provides one way of looking at this relationship between affordability and homelessness. But I've provided the little QR code there that you can scan with your phone if you're really interested, and it will bring you to a web page that has more information about the findings that I'm about to present to you. So I'll leave that up there for a second. Okay. So I recently collaborated on a study with 2 colleagues, Chris Glynn and Dennis Culhane. And what we tried to do in this study is to look at the relationship between housing affordability and rates of homelessness. And this slide that you see here is just a summary of the key finding from that study. And what you see on the x-axis is the median income to median rent ratio in a community. So the community level median rent divided by the community level median income. And on the y-axis, you see the rate of homelessness in a community. And what I want to highlight for you guys is that what we found is that there's this inflection point where when the ratio of median rent to median income exceeds about 32%, you see the relationship between housing affordability and homelessness really take off. So you see a gradually increasing relationship as housing becomes relatively more expensive. And then when you hit that threshold, that 32%, where median rent is 32% of median income, you see rates of homelessness really start to skyrocket. And this is actually significant because it kind of maps onto what's considered the rule of thumb at the household level for housing that's considered affordable. Housing's typically considered affordable when folks are spending 30% of their income on housing. The other thing that we did in this study is that we essentially tried to group together communities that were similar to one another in terms of their median rent to median income ratio. And we tried to see if the relationships between housing affordability and homelessness differed between different types of communities. And what I want to highlight for you is that one group of communities that we identified, there was about 54 communities in this group who comprised about 15% of the overall US population, but accounted for about half of the homeless population. And these are communities that had relatively high housing costs. On average, the median rent to median income ratio in these communities was 38%. So it includes communities that might come to mind as places that have really high housing costs, places like San Francisco, Los Angeles, New York, Seattle, Portland, Oregon, Washington, DC, and Boston as well. And what we found is that in these communities, the relationship between housing affordability, this median rent to median income ratio, is actually stronger in these communities as compared to other communities. So to put this a little bit differently, there's basically evidence showing that the affordability homelessness relationship can and does operate differently in certain communities, and it's particularly strong in high cost communities. All right, another question that gets posed is whether income inequality has an impact on homelessness. And again, I'll cut right to the chase here and say, yes, there is a relationship between income inequality and homelessness, but it's mediated through the housing market. And again, here, I'm going to share just briefly findings from a study on which I worked that kind of looked at this affordability, this inequality, income inequality, homelessness relationship. In case folks are interested, you can kind of scan the QR code there. So I collaborated on this study with a couple of colleagues, Ben Hedwood and Anthony Orlando, that looked at the impact of income inequality on homelessness. And basically, we hypothesized that there's two mechanisms by which inequality might impact homelessness, but in both cases, the relationship's mediated through the housing market. So one hypothesis is that income gains of low-income households, the presence of income inequality, doesn't keep pace with the income gains of higher income households. And as a result, some low income households essentially get priced out of the housing market and fall into homelessness. And so we talked about this as the income channel, the mechanism, the income channel through which inequality might impact homelessness. And the other hypothesis is essentially that income inequality can drive faster housing appreciation, housing price appreciation than would otherwise be the case, and that would translate into relatively more homelessness. All right, so we were interested in whether income inequality has an impact on homelessness at the local level, and whether this relationship between income inequality operates through the income channel, the price channel, or both. And again, these are all studies that are using these point in time count data that Reardon was talking about. They are a really valuable tool for understanding the causes and solutions to homelessness. And so what we found, again, is that there is an effect of income inequality on homelessness. And just to give you a sense of the magnitude of this effect. So if you were to take a city of about 740,000 people, which was the average size of the communities in the study that were included in our study, and it's roughly the size of Seattle. If you were to assume that that city experienced an increase in income inequality between 2007 and 2009 that tracked with the national average change in income inequality, we would expect that that city would have an additional 800 people experiencing homelessness on a given night relative to 2007. And we found in this study that really it looks like the relationship between inequality and homelessness operates through the income channel. So it's really a story about lower income people being priced out of housing markets, their income not rising to keep pace with changes in housing costs. All right, so the second point I want to make here is that we have evidence that at scale policy interventions can reduce homelessness. So there's a growing body of research that uses these point-in-time data that Reardon talked about, not only to look at the causes of homelessness, but to look at the solutions as well. And what I'm showing here is just descriptive data showing relationship between changes in the availability of permanent supportive housing and rates of chronic and veteran homelessness. So let me try and break this down for you. The blue line shows changes in the supply of an intervention known as permanent supportive housing between 2007 and 2018. So permanent supportive housing is an intervention which provides a long-term housing subsidy paired with ongoing supportive services. And it's often operated under the Housing First model. And the basic idea is that instead of making people comply with some sort of treatment regimen before they're able to have access to permanent housing, you basically give them immediate access to permanent subsidized housing, and then you provide them with supportive services that are necessary for helping them maintain their tenancy and to get access to services in the community that they might need for other things like health services, for other issues that they might be facing. And lo and behold, this model works really well. There's been randomized controlled trials at the individual level, so the same way that they test the effectiveness of medicines, the same way they tested the effectiveness of the coronavirus vaccine. They've done this with permanent supportive housing, and it is highly effective. And this is an intervention that's been targeted in the United States primarily to folks who are chronically homeless, so folks who are experiencing long-term homelessness, who've been homeless for years and years. This is the most high-need segment of the overall homeless population. It's been targeted to this group and to veterans experiencing homelessness. And so you see changes in the rate of chronic and veteran homelessness in green and red there. You can see a clear trend here. As the supply of permanent supportive housing goes up, the number of chronically homeless folks and veterans experiencing homelessness has gone down. So of course, correlation doesn't necessarily mean causation here, right? There's a relationship between these two things that's quite clear, but there actually is more rigorous research to back up that this is a real relationship. So what I'm showing here is basically a graph from a study that I did that looks at the relationship between permanent supportive housing and rates of chronic homelessness over time in a more rigorous way. And this is the blue line and the red line are just two hypothetical communities. The blue line is a community that hypothetically expanded its supply of permanent supportive housing, and the red line is a community that expanded it to a lesser degree, and you see faster declines in rates of chronic homelessness over time in a community that increased its supply of permanent supportive housing. So other people have done this in an even more rigorous way to find even stronger evidence of a causal impact at the community level of the expansion of permanent supportive housing on rates of chronic and especially veteran homelessness. All right, so the other question is about whether there are policy interventions that have collateral benefits in terms of the extent to which they might reduce homelessness. So I'm working on a study now that looks at whether states that have extended foster care to age 21, whether that translates into reductions in homelessness among youth age 18 to 24, because youth aging out of foster care are a high-risk group for experiencing homelessness. And again, we do see an impact here. This is a policy not specifically about homelessness, but it has a positive knock-on effect in reducing homelessness. All right, and there's other potential examples of policies that might have a similar collateral effect targeted to specific populations. So for example, supporting folks re-entering society after being incarcerated. Such a policy that would provide folks with greater degrees of support might actually reduce homelessness in the aggregate, because this is, again, another group that is at a very high risk of experiencing homelessness. All right, so just to sort of sum things up, I'll just kind of try and hammer home my key points again. First, homelessness is a housing problem. This is really clear from the empirical research that uses community level data to look at the causal mechanisms of homelessness. The other thing I want to make clear is that the scope of this problem in the United States, we're talking about 600,000 people on a given night, or 1.5 million people over the course of the year, as Reardon talked about. This is of a magnitude that this problem is totally solvable. It's not insurmountable. This is something that we have within our capacity to solve. And we have good evidence about what types of policy interventions are likely to work. We know from these data that at scale, housing interventions can drive reductions in homelessness. But what we need are creative ways, and in particular, more resources and more political will to implement these solutions at scale to really end homelessness once and for all. So I'll stop there. Thank you guys very much for having me. Appreciate the opportunity to talk to all of you about this.
Thanks so much for that, Tom. So if there are any questions, clarifying questions, maybe we can start with those, but I'm eager to shift us into roundtable discussion. And I'm absolutely happy to keep it sort of, I've got my screen set up so it's not speaker view. I'm seeing everyone's faces at once, which I think is in the spirit of the roundtable. Hopefully y'all are in similar positions. But yes, I'll open it up for conversation and commentary.
Sam, I think there's a question in the chat.
Thank you.
A clarifying question, if you would want to go through that one for Thomas.
That being, could Tom say a bit more about the type of about what type of support is available in supportive housing? Is it provided within the housing complex or by other means?
Yes, this is a really good question. And the first thing I would say is, so permanent supportive housing, a lot of folks who are in permanent supportive housing, it's not necessarily in a single building. A lot of folks who are in permanent supportive housing are supported in private market units that are in, just regular apartment buildings that are scattered. They call it scattered sites. It's just in the community, renting an apartment as would anybody else. So there are some permanent supportive housing programs that are structured where they're located at a single building, but by and large, that's not the case. So, the supportive services are really intended to be flexible in nature and tailored to what individuals' specific needs are. So it could be, it can be a lot of different things depending on what it is that folks need. The challenge sometimes is that the housing costs are typically paid for by HUD through a housing choice voucher or a project-based Section 8 in the case of the subsidy is usually from HUD, and the supportive services aspect of it can be a little bit more challenging to finance. Here in Massachusetts, actually, there's been some great work. I know that you guys, I think the presentation in October, you had some folks from the Mass Housing and Shelter Alliance, and some of the folks that are with that organization a number of years ago worked with the state Medicaid program here in Massachusetts to create a special program where Medicaid funds could be used to pay for the supportive services component of permanent supportive housing, which is a pretty big deal and makes it much easier to provide that type of housing.
Excellent, thank you.
I have a question for both Tom and Riordan. My name is Xander. I work for Pine Street Inn. We're a shelter and housing provider in Boston. And I'm interested in using point in time count data to make inferences about national homelessness policy. And one of the issues that I can't seem to get over is in every locality, there are different policies to address homelessness directly. But we're talking about homelessness essentially as a function of housing affordability. Now, since efforts in Boston differ from efforts in New York City, differ from efforts in LA, differ from efforts in many different rural areas, how can we draw valid inferences about the effects of policies when the effects aren't coordinated and differ across different localities? And I'm not aware of any work done to model or account for those directly.
Yeah, it's a good question. You know, there's, what I would say is sort of the more rigorous studies that have kind of looked at the impact of policy interventions on aggregate rates of homelessness. What they try and do is capitalize on within city changes in homelessness. And sort of an advantage there is that you're kind of controlling for anything that's different across cities that is time invariant, that doesn't change over time. So you can sort of pick up some of you can sort of account for some of the local policy nuances that way. You can't account for everything that way, for sure. The other thing that's been done is there are some studies, and this is where you bump up against some of the limitations of data. So there are studies that will, you know, look at within the effect of within city, with effect of sort of city level policies. So probably about 9 or 10 years ago, there was a program in New York City called Home Base, which was a homelessness prevention program. And just because New York has relatively better data than do a lot of other places, and since their population is primarily folks, the size of their unsheltered population is relatively smaller, you know, you could use their emergency shelter data to do a pretty good study looking at the impact of that homelessness prevention policy. But it is, I mean, it's sort of and there's a study that was done out of Chicago that kind of capitalized on sort of a natural experiment to look at homelessness prevention, but it is challenging, for sure.
So you're referring to like using a fixed or a random effects model to?
Yeah, so a fixed effects model would kind of
Right.
account for kind of any time invariant factors that differ between cities.
That makes a lot of sense. Yeah, I'm surprised I didn't catch on to that yet. Thanks.
I'm happy to connect offline too. I see a number of friends from Pine Street in here too. But yeah, I'm happy to connect on offline about this stuff.
Definitely.
Yeah, I think Tom answered that well, so I'm not really going to repeat much of that. But I do think that what you'll run into too, as an issue to flag, is that you're working with pretty low samples in some areas of the country. You know, one of the reasons that I have trouble just showing percent change sometimes, because I think it's misleading. You know, in a place like North Dakota where it's a couple hundred, and then it, you know, increases by maybe 50, and then it's like, oh wow, look at this 50% increase. And so, you know, like that will also pose some difficulties with different methods that you would use depending on where you're focusing with those. So some places, I think with shelter data might be a little more reliable and have larger sizes for that, if you focus on those.
So I have a quick question, very simple. We talked a lot about data here, and us as designers and architects, we can't work on anything without having information and data on our user group in numbers and their demographics and so on and so forth. So where would we go to learn more or get educated about this particular user group and typology for data?
Yeah, well, I mean, I think obviously a plug for Joint Center for Housing Studies. You can go there for some of our homelessness analysis. But we actually have a lot more, I think, research to do on that and stuff. So I think that you can kind of visit these other organizations that analyze these data. And then get into AHAR data yourself. I mean, it's definitely somewhat difficult to work with, but once you get it up and running, you can really dive into a lot of different aspects of it. And what Tom just put in the chat there, if you want to expand on that.
Yeah, I mean, the only one good starting place is, the National Alliance to End Homelessness, which is sort of the lead national advocacy organization around this issue. They put out a report every year called The State of Homelessness, which is essentially like it sort of repackages and adds some additional, it repackages the point in time count, the annual homeless assessment report data that we heard about earlier, but just makes it a little bit more accessible than was in kind of the official government report. So that's a really good source as well.
Perfect. I see, Matan, you have your hand up if you'd like to weigh in.
Thanks so much. Yeah, so a question about point in time data. So in a number of places, and certainly in Boston, we're trying to use the point in time count data as a bit of a baseline where it comes to looking at the racial equity outcomes of our work, and try to at least get a sense of are the outcomes of our work at least comparable to the to the baseline of a disproportionate effect of homelessness on people of color in the first place. Are we doing at least no worse than that, and hopefully better? I think we struggle with the point in time count being that single count over one night in a year, and then looking at proportionality in that sense, so now you've reduced your sample, and now you're stratifying your sample. And then, even further, sometimes we try to look at people experiencing unsheltered homelessness, and your sample sizes are even smaller. And so our proportionality attempts are really kind of all over the place. And so sometimes we try to look at multiple years and sort of average it out. But any thoughts on how to use baseline data, whether that be point in time or something else, to reflect on the racial equity outcomes of our work?
It's a tough one. It's in the when I think about this stuff, it can be so challenging because the things that have contributed to the huge racial disparities in homelessness stretch back decades, hundreds of years, and are kind of the accumulated effect of hundreds of years of policy decisions, among other things. And so, what's really stark is there's been a couple studies. We did one looking at veterans specifically, and there was another one using kind of this health and retirement study. So basically asking folks it's a nationally representative data source looking at older adults, and basically one of the questions was about, have you experienced homelessness at any point in your life? So in those data you see massive racial disparities among older adults, so you're looking kind of back at people's entire lives. So this is not really an answer to your question, other than I just wonder if the framework for thinking about it should it be, let's not focus too much on can we track any impact of this in the short term. I totally get why that's important to do, but also, this is going to be sort of something that requires a long-term effort. And if we sort of think about it in those terms, if we don't see an impact in the shorter term, that doesn't necessarily mean we're having no effect. It may mean that we're trying to undo lots of really big things. But I don't know. Yeah. That was a classic not answer your question, but that's sort of how I'm thinking about it.
Yeah, I would say like the instinct of kind of pooling years is a good one. You know, I work with ACS data, American Community Survey data from the Census Bureau, and whenever you want to get into the kind of lower levels of geography and really dive into those things, you use the 5-year data. And so I think that could be a really good way to look at it. Obviously, the timeliness is kind of lost when that happens, but I think that could be really good. And I think that you know, I use census data to kind of compare for proportionality in terms of like you know, what percent of this area is made up of you know, like what is the racial ethnic breakdown of this area. And I didn't show it in the presentation. I showed the kind of student homelessness data with demographics, but I've also calculated that using the point in time data on the national level. And yeah, you really see these really stark differences. Like Black people experiencing homelessness it's about 40% of all people experiencing homelessness, and it's about 13% of the overall population in terms of Black residents. So I think it's a really important thing to look at, and it's a really important thing to address. And I think, yeah, just pooling years, I think would be a good first step, and using census data to kind of really dive into where you're at population-wise could also help.
I have a question, something I want to bring into the conversation, thinking about that really interesting sort of turn where you see, I forgot the exact terminology, but the sort of cost of living burden and the home, like the rent price. What was that intersection again, Tom? It was the...
Yeah, so it's basically looking at if you compare median rent to median income in a community. So, you know, when you hit about when median rent is about 32% of median income in a community, that's where you sort of see that inflection point in communities where kind of the, yeah.
So with that, I just wanted to draw into it a hot topic, you know, in the news and in our lives right now, that being sort of the rise of inflation, and how that's anticipated to impact sort of that moment. Does it sort of sharpen the angle of, you know, the increase in homelessness, or does it have an impact? How can we think about that as an issue that's current in the news? It's also impacting this question of homelessness.
Yeah, I mean, so and probably Riordan can speak a little bit more to this too. You know, I think it's, you know, housing costs are rising at a faster rate than the cost of other things. So certainly the rising costs of rents is a big issue and is a huge potential driver of increases in homelessness. I think one of the things that's most interesting to me every year when Riordan's organization comes out with the State of the Nation's Housing is they put a chart in there that actually looks at essentially changes in affordability at different income levels. And the thing that's interesting is kind of these affordability challenges have been kind of creeping up the income spectrum. So it's, you know, if you're a low income household, those folks, almost universally, everyone's paying more than 30%, most of them more than 50% of their income towards rent. But when you get up into people who, you know, are what we would consider middle class or above in the United States, those people increasingly are facing cost burdens. And so I think housing affordability is becoming an increasingly salient policy issue. And I think that has a lot to do with it, is that I think everybody's feeling these rising housing costs, no matter where you are on the spectrum. You know, these are things that people of very low income have been dealing with for a long time. That hasn't changed, but higher income renters, people trying to buy houses, everyone's sort of dealing with this. And so I think, yeah, I mean, so I think rising housing costs are only going to make homelessness worse based on what we know about the relationship there.
I would agree with that. And I just put 2 links in the chat. One is to the rental housing report that we just released last month. And then another one is an interactive chart that we released as part of that report that kind of shows home prices and rent prices. And what that one really shows is that, and you can look at it by different metros and stuff like that. And but what it really shows is that, you know, rent has a lot of attention has been on home prices, but rent has also been growing really exponentially. And I think what you're really seeing, you know, Tom's exactly right, is that you see this affecting people further up the income scale, and then you see this kind of squeeze essentially that happens down and down the line. And the National Low Income Housing Coalition always has a great report, the GAP report, that shows that basically when someone can't afford or there's no unit available for their particular income bracket, you know, they basically occupy units down the income scale, and then that has a cascading effect down from there. And definitely, I think that would contribute to housing insecurity and even homelessness.
That's interesting. Helpful. Thank you.
So I have a question too, which is always on my mind. Is there a place somewhere where we can go and find data on what do we need for what type of housing? Because as we know with homelessness, we have, you know, the emergency, the transitional, the permanent, and so on. They're like 4 different types. Is there a place somewhere where we can go and say, okay, for the state of Massachusetts, or let's say just for the Boston area, we're gonna need this type of housing for so many people. We're gonna need to provide this much for transitional, this much for permanent, to at least start, you know, tackling the problem from a housing perspective. And Tom, you made a very good point. A lot of us thinks it is really related to health and mental and problems, but your graph and study shows very well, once you provide housing, that kind of helps that problem a little bit, because individuals are sheltered and supported and kind of solving the problem as they're housed. So I wonder if the state has some handle on the numbers of what do we need, let's say, how many type of housing, like Pine Street Inn, or, you know, like Women Lunch Place, or what, you know, we see so many different types. Is there data on that?
I mean, if you're talking specifically about homelessness, I was involved a little bit in some work with the state trying to estimate that. I don't think there's sort of a central source that breaks it down. You know, one thing to think about is, you know, if we think about homelessness as a problem that's ultimately rooted in housing affordability, certainly, you know, I think the city of Boston, you know, has put out, at least under the previous mayoral administration, put out some targets around development of how many new housing units we need. And so that's a good source. And then I would say, you know, the report that was just mentioned called, it's called the GAP, which is from the National Low Income Housing Coalition. It'll sort of say Massachusetts has, you know, something like 30 affordable housing units for every 100 people who need them. So that kind of gives you a scope of it, but I don't know that there's a specific source that will say we need 30 units of this for, you know.
Thank you.
I'd like to push with Corey's question a little bit. I'm curious, if I were a young architect and I happened to collapse into your office one day, just collapse in the chair and say, my firm has just been retained to design a new luxury condo building, and it's 250 luxury units, and I'm just not sure if that's going to serve the market right with what it needs. What would you tell me?
Yeah, I think it's tough. I think that you know, the kind of classic YIMBY line is that we need more housing of all types. You know, and I think that is still largely true, but I think it's hard to stomach sometimes when more locally when you go to a place like Seaport and you're like, who's this serving, or something like that. But I think it is the case that, what we would really benefit from, I mean, obviously affordable housing, the Cambridge housing overlay, I think has been really valuable, for that, in terms of making it easier to build those types of things. But what I would love to see more of is like the kind of missing middle, income housing, because again, as that LIHC report found, if people who are kind of middle income can't find a place to live, they're squeezing out the lower income places. So, but even the luxury places, I mean, we still do have, a fair amount of high income jobs and stuff. And so I think that if you provide that, you will ease up pressure on that market. But yeah, but I would definitely commiserate with you about the what seems sometimes like the glut of luxury housing. But what we found in the rental report is that there's still a lack of housing overall, in terms of that, because largely because, after the Great Recession, there was a huge drop off in construction. And so there's just a lot of catch up that we need to do. We haven't been constructing at levels that we're now constructing since like the 80s. And now we're finally catching up, but it really takes a long time for that to take an effect.
I also want to add that usually in most of the towns, like every time there is a housing project, there is a requirement for affordable housing within that project, and it's a percentage. And I'm not too familiar. I'm familiar with Wellesley, but I'm not too familiar with the city of Boston. I believe you do need to provide with so much amount of units of luxury housing affordable within that particular project. So again, it's these projects are owned by developers and not by the city. So hopefully anywhere the city have the opportunity to develop a land with housing, it probably will have a better way of addressing that from your point of view in terms of affordability.
I'd like to be sensitive to the fact that I guess we've come up on 6 o'clock. So I don't want to keep our guests here any longer, than they have time to spare. So please, feel free, y'all to say goodbye. The panel, the roundtable kind of may continue to linger for a moment and continue to think out loud and ponder these things. But we thank y'all for your time, for your presentations. It's been really great to see what each of y'all are thinking about, how you're working and how it connects.
Thanks a lot, everyone. Appreciate the conversation.
Great. Thank you, everybody.
Thank you.
Thank you, everyone. And don't hesitate to contact us, Sam, myself, and the presenters. And we want to continue this conversation. And we're hoping our next session will be on the typology and type of housing and shelters from a design and architectural, what we do every day, just to understand what's out there. Thank you.
Great. And Sam, it occurs to me I had a lot of links included in my slides. So you're going to be sharing those with folks?
Yeah, they're usually included in the recording, so they should all be made available. If it's using Panopto, if the BSA is using the Panopto, I think there's probably very few competing companies for who's recording via Zoom. So yeah, we should have those links all set.
Cool.
Thank you.
Sounds good. Well, thanks very much. I'll talk to you guys later.
Thank you so much. Have a good one. Bye.
Thank
You
you.
too.
So we have 2 more people here. I'm available to continue the conversation if anybody wants to continue. Sam, thank you. That was a great session.
My pleasure. My pleasure.
Yeah.
Happy to help while you're in recovery here.
Yeah, we'll be.